Well, let's go ahead and get started. I know that we've got a pretty robust crowd of folks that are tuning in, and hopefully we'll have some more people join in as the conversation unfolds. My name is Dr. Richard Pineda. I'm the chair of the Department of Communication at the University of Texas at El Paso. Some of the Burrell family know me from the professionalism sessions that I've run for the college, and I've met a few other folks along the way. By way of introduction and to also kind of keep everybody on the same page, the idea for the forum germinated almost immediately after the events in Minneapolis a couple of weeks ago. And John Hummer, the president of the school, called. John is a very good friend of mine and very much wanted to figure out how to begin to have some conversations, not only about race and the way that students are dealing with those issues, but also to talk about what perspectives we are missing from the conversations when it comes to medical training, healthcare, and race. And so from that conversation that he and I had, the push was to try to get a forum put together as quickly as possible. And something that I think is also significant is the idea that the college is committed to having more fora in this fashion, not only to have some frank conversations, but also for perspective building. And I think that that's important. I think that the other significant factor that we talked about, that John and I talked about, was something that I bring to the table. I do a lot of process observations. I watch organizations, I watch meetings, and can evaluate how some of those conversations are happening around a table. And so he thought that bringing in that skill set for me from a third party perspective might be helpful, and also give folks at Burrell the groundwork to begin to formulate how they would have these conversations. So today's conversation is one that I'm very excited to have. I think it's one that is significant, and I think there's some great voices at the table. What I'm going to do is very briefly just introduce the three participants, and then we'll dive into the first conversation. So we're joined from East El Paso by Dr. Oge Aloze, who's the Chief Medical Officer for the Del Sol Hospital, and is a faculty member in the last several years for the medical school in El Paso, but also is significant for his role in dealing with infectious disease. And so one of the reasons that Dr. Aloze may look familiar is that he's in fact been on a media blitz over the course of the last several weeks, talking about and explaining COVID-19 and the implications for people in different capacities. Adadayu Balagan is a medical student at Burrell, hard at work and studying, as we discovered in the pre-conversation, getting ready to dive into his first exam, I think, on Monday. And Whitney Ubero is a medical student who is also in the process of studying and getting ready for her third year. So our conversation today is fluid. I want to say this at the very beginning, because I have been involved in a couple of these conversations. I myself grew up in El Paso and am very uncertain a lot of times about how these conversations move forward. I mean, there's always a part of me that thinks to myself, okay, so let's do this, let's have this conversation, and then not know what's going to happen and not know that there's any significance to that. And one thing that I reassure myself with, and I hope that this is the case today, is that a conversation like this is just as much about giving expressive space as it is to talking about things that may be uncomfortable. And I'd like to think of this as a safe space in that regard, but also this recognition that part of this process is as much about hearing perspective and recognizing that there is no ready solution, but to begin to have conversations in the way that I think Burrell is committed to doing, I think is a huge step in that regard. Without further ado, if we would start, and we'll kind of rotate. I've got one question to start with for the three of you, and then we can kind of jump from different perspectives and certainly open up space. But here's the question for the three of you. You are in various stages of your experience, obviously, come from different backgrounds, growing up in different parts of the United States. Oge growing up in the U.S., then not in the U.S., and then back in the U.S. Here is the question. The events over the last 2 weeks have been troubling to say the least. But what is your take? I mean, as you look at this from your position right now, where are you, and how do you feel? I mean, I think that's the best question to start with. How do you feel at this moment? Okay, we'll start with you, and then maybe go to Whitney, and then go to Dayo.
Yeah, sure, thanks. How do you feel? I mean, that's always one of those questions, right? It depends on who's asking. If I have my Nigerian friends that ask me, we have a very different conversation. My non-Nigerian Black friends that ask me, it's a very different conversation. My white friends that ask me, it is the reality of what it is. I think I saw an article, there's a bunch of stuff on social media, but I saw an article the other day that I will not do a good job of finding in the immediate moment. But one of the things that the author said was, you have a checklist in your head, right? You have the smile, sound articulate, don't intimidate, don't talk too harshly, right? Don't talk about race, and definitely don't talk about racism. And so in my position, it's kind of weird, right? I mean, I have very strong feelings. Historically, I've always been one of those people that is probably not as patient as I should be, considering my age and my position and how long I've practiced. But I think all of us were not just shocked, but it almost felt like initially sort of the same old, right? Another Black dude killed by police. And then you have the horror and the shock, and then there was this flashpoint. And from an epidemiological standpoint, right, like you said, we've sort of been talking about coronavirus and the pent-up frustration of people being at home. The moment, and maybe from a sociological standpoint, it's because for one of the first times in our history, when cops do what they do every year and kill a Black man, people had the time to listen and stop. And they were forced to listen because they were at home, right? And they were tired of thinking about coronavirus. And so there was that flash in the public. And then, like you said, me growing up in Minnesota, St. Paul growing up, Minneapolis, the 10 years before I moved to El Paso was like deeply personal. And so the anger, the shock, the frustration, one of my friends, Game of Thrones people, was like the Dracarias, right? Burn everything down to the ground. But understanding as well, right, that isn't always the best way to go about things, but completely understanding the pain, frustration, anger, and hopelessness that people have. I mean, the moment that we've had, or these moments that have happened not just in this country, but around the world, have really been amazing and almost crazy sort of to watch and to see everything that's going on. You just hope that it's not just a moment, that something actually will come out of it. And I know some things have come out of it in terms of charges being changed, certain municipalities and cities potentially changing their budgets, right? The Minneapolis City Council saying they want to defund police, and that's a whole different other firestorm. But I just truly hope that it's not just a moment and that we can grow and learn and actually have meaningful change. And like I've been telling every single person I know, and I raise a lot of money every year for politics, get your butt off your seat and vote. I mean, that's for me, that's the most important touch point of 2020. If you're angry and you don't vote, you failed George Floyd, Ahmaud Arbery, Breonna Taylor, and every other single person that's been killed by police.
Whitney?
I'd like to just echo everything Dr. Lozzi has spoken. For me, especially being 25 years old, I think there's a lot of shock that comes with this. You grow up, you get taught all of these things through history. And I guess it never quite occurred to me that I'd actually be going through the same thing in real time, especially at this age. So it's that, and it's also just what I feel is mental and emotional gymnastics. Just the trauma of it all, the gaslighting, it's just exhausting. And it's like I'm split between wanting to make sure I'm keeping up with what's going on in the world, but also just trying to keep mental peace and trying to do med school and just trying to navigate the world as a Black woman and a Nigerian American woman and young woman at that. And it's just, it's rough. It's been tough. And everything that Dr. Lozzi has said, I definitely agree with 100%. And I just wanted to add that it's just so traumatic, I think, to be constantly reliving this and reliving this over and over and over. And also, it's quite strange to me that I didn't know that at this day and age in 2020, watching people die on camera would be so readily available to the population, and specifically Black people. So that has been very hard to, it's been a tough pill to swallow. And just seeing the videos almost being sensationalized at this point, it's just recording after recording after recording after recording. And it's become a very painful and form of, weaponized just trauma. And even in the last killing of Ahmaud, that was video recorded, and he's detained now, he's in jail. Because it's almost now a fun thing for people to watch and do. And so it's a very sad time, and it's very hard to just be dealing with this and trying to live a normal life at the same time and act like everything's okay when it's not.
Dio?
For me, just like Whitney and Dr. Alozi, I have a lot of those same thoughts and feelings. The main thing I remember for me personally was, because I'm spending so much of my time studying, I tried not to get too far into it, but I know because of COVID-19 and the fact that everyone's been, I guess, stuck at home or stuck and had the availability to watch all this, that it has maybe echoed a little differently. It's weird because it seems like there's so much of this recently, even though it's really not that different than anything in the recent past. I think I'm not gonna lie, I wasn't shocked at the George Floyd thing. I didn't feel that at first. It was more like it's another Black person. This is sadly become all too common. It's almost like the same thing with school shootings or mass shootings. They have become so commonplace that although they're still tragic events, they don't quite hit the same anymore, because they're at the point now where it's this is just a sad reality for what it shouldn't be like this, but this is the sad reality of where we live now. But what did surprise me in a good way was the outpouring of the protests and people speaking up. And actually, it seems with how Minnesota's addressing stuff, and then the law that New York just passed recently about chokeholds, that people are trying to genuinely work to stop police brutality and to try and maybe find other ways to prevent these things. So that part is the part that actually surprised me. And I don't know if it's because we've seen this was the third or fourth one just within the time that most people have been quarantined, with Ahmaud Arbery and Breonna Taylor and George Floyd. And even then there's others like Deshaun Reed and other people that have this happened to just recently. So I think maybe with the stay at home and people tired of being in their house, and then the mass layoffs because now where unemployment is really high, and all the extra frustration that maybe it reached a tipping point where people had to go out and do something just for their own sanity. And I'm happy that there is some sort of outpouring, and there's a way that hopefully we can move forward, and hopefully this momentum doesn't just stop whenever everything opens back up. Me personally, I did not watch the video of George Floyd. I can't do that to myself anymore, because I think about my own self, because all I did was bring up stuff my parents used to tell me on how I'm supposed to deal with police officers. To this day, if I'm ever stopped by a car, I remember one time I was stopped for I don't know, I was pulled over. It was a checkpoint for drunk drivers, or maybe it was a speed trap or something. And I remember when I pulled over, and I had one other friend in the car with me. I can't remember who anymore, but I rolled all my windows down in my car. I took my wallet out, I put it on my dash, and then I put my hands on the steering wheel. And my friend was like, "What are you doing?" I was like, "I'm trying to give no inclination that I'm reaching for anything. I'm doing anything that could get me in this position," because that's the first thing that comes to my mind whenever I have any interaction with police officers. And I know not all cops are bad or can do stuff like this, but it's such a real fear for me that my parents and me and my family members have this is like how I do things. This is like the best chance I got. And even then, I know things can still go wrong. So it's a lot. This is brought up a lot, which is why I could not watch the video. I've seen like the still images. I know how long he was there. I've read quotes on like all his last words. I've taken the time to like look into it, but watching that video is something I couldn't do. Especially because I did watch the Ahmaud Arbery video and it brought me to tears and I couldn't like bear. It's at a point where I was like, I can't like keep seeing this. It is something like I do for my own mental health, especially because I'm still worried about this big, and I don't like putting it into this context because it seems a little selfish, but like I still have this test that's important for my own career going on that I'm trying to focus on. So it has been a lot. It is a lot, and I'm glad that there's so many people and so many allies that have come out. But I hope it just keeps moving forward.
Alozie, I've got a question for you. I think this idea of what we're talking about, I think what Dave is talking about, especially in terms of trauma, lived trauma, for a long time, there's been a conversation about thinking about gun crimes as a health crisis and rebranding this or refocusing those efforts to talk about this as a public health crisis. Are what we see now, and especially in the Black community, the sort of trauma that's being lived, do we need to think about this as a public health crisis as much as a social or community crisis?
So I think that the short answer is yes, but the longer and deeper answer is that it's always been. It just hasn't been acknowledged to be one, right? I mean, I'm older than Adebayo and Whitney, and I mean, the same things that happen today, I thought of then growing up, right? My Nigerian mother, who worked 3 jobs to keep us afloat, she told me the same thing. Don't go out after dark. Don't be around police. Don't do X, Y, Z, right? It's one of the reasons that she sent me back to Nigeria to finish up high school when I was a junior, because she had very grave fears about my ability to survive in the country. She had that opportunity, or I had that opportunity, right, before I came back. And so I don't think it's anything new. I think whether, you know how it is, Arpanita, we as a society, we grapple onto things or we grasp onto things because they sound cool or they sound new. There's nothing new about this. It's 400 years of enslavement, right? 400 years of disenfranchisement, right? 400 years of not being able to play Monopoly at the table, right? And those of you that have seen the video understand exactly what I'm talking about, right? Whether it was Tulsa or Rosewood, wherever it's been, and excuse my French, it's the same bullshit, dude. So I think that we have just learned, right, to put on the face, because you got to put on the face, especially in this professional world. I mean, I'm 6'3", 260. And so I've had to learn how not to be the angry Black man all my life, right? And so this is one of the few times you'll see me get a little passionate or angry, because it's a safe space and nobody on this call is going to get me fired. And then when I go back into the boardroom, I got to be the chief medical officer, right? I got to be one of the best 5 HIV doctors in the state, if not the country. And so it's a different mask that you wear for every place. From a public health standpoint, I think it's disingenuous, and I've heard public healthy people start to say, we have a new crisis. No, we don't have a new crisis. It's just that it's crossed your agenda for the first time. It's crossed your agenda in a way that has punched you in the face, that has made you see it, and hopefully made you engage in it, right? Like Will Smith said, racism is not new, it's just being televised, and it's being recorded. And so those are the things that push people, and the NFL and the PGA and potentially NASCAR, when they start to talk about it, I think that's when people start to say, wow, this is actually something that affects us. It's sad that it has to take that, but yeah, that's really where we're at.
So Whitney, I want to move to a question, because I think you were I saw you nodding along to Dr. Alozie. So the idea of faces and the performance of identity is something that I'm really interested in, and something that I grapple with all the time. Being Mexican American and having a PhD, I'm in a unique environment that there's a few more of me than usual, but I mean I'm an outlier, right, by every standard. Whitney, you have to negotiate, and you alluded to this earlier. You're negotiating a number of different. I mean, you're at an intersectional place, right? So Black and female, a medical student, activist. Like you're dealing with a number of different intersections. How do you put on those faces, and how much extra effort is it to be able to live in the intersection, as opposed to not having all of these things that you may represent for people, or that you want to represent for people yourself?
Well, I will say, interestingly enough, as they have spoken, this is something we've been taught since we were children. My parents are both Nigerian, they're Nigerian immigrants. This is something that it's almost embedded in you, in your DNA almost. These are things that are taught and ingrained in you at such a young age that at this point, navigating and maneuvering the world is something that Black people have come to understand as almost a craft. It's just something, it's second nature. It's something that I do every day. I try not to be the typical stereotypical angry Black woman. Sometimes if I have an opinion, or I feel strong about something, or I feel confident in what I'm speaking about, I feel like I need to pull back, or I feel like, oh no, I hope it didn't come off this way or that way. And just, you worry about the repercussions. But as far as extra effort, it's something I do all the time. Is it more exhausting now? I think what becomes more effort is just having to deal with it and see it and see it and see it. But as far as dealing with it every day, it's just something I know how to do. You have to be the medicine, you have to be the smart one, and you have to be the professional one. You can't have certain opinions, or you feel as though you can't express certain opinions because of how it may be received coming from you. So maybe your friend, non-Black, can say the same thing and it'd be more palatable. You know what I'm saying? So you kind of just learn how to maneuver, you learn how to navigate different spaces, just as Dr. Lozzi was saying. I mean, everywhere you go, you have to be in line with where you need to be for that given, situation. So it's just another thing that I carry, and it's become a weight that unfortunately just seems like it's normal. But I know it's extra weight, but it's normal for me at this point.
Dario, I've got a question, because one of the things that you had talked a little bit about was the idea that seeing allies come out has been powerful. But this is an interesting question, and one that I think is something that people are grappling with. So there's been a lot of conversations about not being racist, right? That we would say to somebody, you shouldn't be racist, and that's a significant step. But then there's been a growing conversation of being anti-racist, and one of the things that's interesting, and I think worthy of discussion, I'd like to kind of hear your insight on this, is when we talk about allyship, is the goal to get people to the point that they're anti-racist and actively fighting back against this injustice? Is it enough to ask people not to be racist? And if it is, because this is my perspective, if that bar is so low that we say, listen, what we'd really like is just don't be racist. If you could not be racist, we're going to be in a much better place. But I mean, what is it from your perspective, especially as a student, but you've had a little bit of a professional career out in California? How do you provide guidance for allyship? Because there is also a time frame, right? And this is one of the concerns, I think, with where we're at with social media and all of the ways in which people are talking about this, that there's a lot of attention. It burns fast, it burns big, and then by next week we're talking about something else, right? We've moved off entirely, and so from your perspective, I'm wondering if you can talk to us a little bit about this idea of allyship, and what's the instruction, if there is any, to think about the idea of being anti-racist.
For me, it's when stuff like this is not going on, how you still present yourself. If you're just like, well, I'm not racist. If you ever have to say I'm not racist, but then whatever you're about to say is going to be terrible. And and like yeah, exactly. So like it's mainly about like being anti-racist is definitely much more important than just not being racist, because if you're not being racist but you're not calling out like another person being racist, or acknowledging someone else doing something that might not be like that's not deemed okay or could be hurtful to anybody, like whether it's racist or sexist or homophobic or something like that, then you're not genuinely being an ally. You're just, not to say something that could get you in trouble, which is not something that's really worthwhile. Like an example is like all these businesses that have come out recently and like have like made their stance like I stand with Black people and stuff. Those are nice words, but like unless there's any like actions behind it, then it doesn't really mean anything. You're doing it because it's something that seems popular or can ingrain you with like positive public opinion right now. Whereas if you genuinely are an ally, you would work to better it like all the time. Like regardless if there was this flashpoint with the George Floyd and all the protesting right now, you would do it when you're like in your hiring practices. You would definitely try to like ensure like you have like a diverse, not just because now it's popular, but because it will actually like better your company. Like I'm like a big sports fan, so like all like in the NFL, there's no GMs that are, or there might be one GM that is Black, if I'm not mistaken, but like the majority of their labor force, meaning like the athletes, are African Americans or some sort of, and like it is not representative. So it seems like the labor is Black and then like the management is not, and so that's like an issue that they have, and that's just one example that I have. But like actionable change would be like actually increasing hiring practices, working to create a more diverse workforce or organization. And I think what I don't want is for like all these people to like come out and like make a statement and say that they're not, but then there's no intention behind it. So that's what matters more to me right now. Is like the anti-racist thing is definitely how I feel. Like if in my opinion, if you're not anti-racist, you may not be racist yourself, but you're allowing racism to continue without doing anything about it. And therefore, there's a quote by Dr. King that I don't exactly know specifically. I can't remember exact words, but it's about how the person who sits on the sideline and does nothing is even worse than the person who's actively attacking you. So.
Dr. Lozzi, I've got a question. I want to change gears just a tiny bit, especially because we've got so many medical students that are watching this. One of the issues that has come under scrutiny over the last several generations is the lack of medical support and medical infrastructure for communities where minorities are a large presence. And that's especially true in Black communities where healthcare disparities, where there's gaps in healthcare, but then there's also these very large disparities that affect the communities, higher rates of heart disease and diabetes. I guess I want sort of an insight first in terms of how much you think racism plays a part in those gaps and potentially enrolling over into those disparities. And then the second part of that is a little bit of advice from you, not only to the medical students, but also to the medical faculty that might be watching. What is it that we need to be thinking about when we train docs? I mean, what is it that we're missing in terms of coverage, especially for these minority communities? I mean, the college has a very unique perspective on race and ethnicity and diversity, but what is it in terms of training docs that needs to really change, or that we need to shift in terms of our priorities?
I mean, that's some great questions, Dr. Pineda. I think I'll take the second part of that first and sort of talk about education and educational opportunities and what can institutions and organizations do. I think from an educational standpoint, at the minimum, and this is the foundational level, not the aspirational level, right? If an organization that does education hasn't had any conversation about unconscious bias, right, they have missed the boat completely, right? And I'm saying that's foundational. That's not where they need to get to, but that's just to put the foundation of the house and start to build on it, right? Now, different areas can focus on inequities or disparities in healthcare for minorities, right? They can talk about how do we encourage BIPOC or groups of color to come into their organizations, right? Whether it's by going to high schools that are local, going to high schools that are across the country. I know when I was in Minnesota, we had an immense problem with getting minorities to come to med school there. or even schools of public health. And then they started doing outreach, right? But it was one of those things, it took an African-American head of diversity, right, to really get into their heads that you're not going to get the kid from Chicago to come to Minnesota. First of all, it's way colder, and you're not giving him any more money. And there's no community that he can dive into, right? And so those are things, these things don't happen by accident. They happen deliberately, right? And so like Daya said, it's good to be, well, I'm not a racist, that's great, but for an organization specifically, if you sit on the sideline and just have an expectation that you'll be diverse, you will never be diverse, right? That's the first failing. And so I think leaders, organizers, administrators, executives, they have to make a determination whether their organization cares about diversity. If they don't care, they don't care, and that's fair, right? And the attendance and all the other things that come along with it will fall to the wayside, and that is, you can't fix everybody, and sometimes you can't fix stupid, so just let it be. I think on the other piece too, where we sort of talk about the public health aspects of lack of diversity, poverty, all those things are intertwined. I mean, when we talk about the fact that the South, or below the Mason-Dixon line, is the heart attack belt, it's the stroke belt, in some places it's the cancer belt, again, those are all remnants of slavery. They're remnants of the fact that people didn't have the right food, right, or the healthier food. They're remnants of the fact that up to today, there's still majority food deserts in those areas. They're remnants of the fact that on average, right, and I'm an HIV guy, but 48% of HIV comes out of the South, right? The risk, I think, is 1 in 22 in Black women, 1 in 11 or 1 in 7 in Black men that they'll get HIV in their lifetime. And that's majority from the tip of Texas to the Atlantic Ocean, right? So all those things, and the VA has shown extensively over the last 20 years that African-American and Hispanic patients get better care by African-American and Hispanic physicians. And yet we know the disparity is there. So again, we're not going to fix this today. We're not going to fix this tomorrow. But I think it's until organizations like BCOM and other healthcare organizations, academic health centers, actually say, hey, this is where we stand, this is what we're trying to do. Yes, we're in an area that has a disproportionately low amount of physicians, but we also want to encourage physicians of color and students of color and nurses of color and a whole host of rainbows, right, to come to our area, and this is why. And so I think that's very important to actually call out specifically.
We want to jump to you, and when you and I talked before the conversation, one of the things that I wanted to have you share with us is the experience leading up to deciding to go to medical school, because I do think that it's always interesting to hear people's take and why medical school? Why a doctor? I mean, did you when we were talking, what really struck me was that you knew very early. You said that you started college and medical school was going to be where you were headed. So why? And tell us how you got to this point.
I think one of the ways, unique experience growing up in a Nigerian home with Nigerian immigrant parents. I mean, the goal is to get your kids to a certain level that you never had the access to. And I think all three of us here are Nigerian as well, so I'm sure that they can echo this. It's just something that is spoken to us as children. So you're introduced to certain types of professionalism at higher levels, sciences, engineering, medical, things like that, law, dental, something that's going to give you longevity and job security. So all of these things were introduced, and I just took a liking to it. My mom actually has kidney disease, so I would always frequently go with her to her appointments, and it's just something that I felt like, okay, I can do. So it's one of those things that was like introduced, and I took a liking to at a young age. And that's essentially how it was. And having the parents that I have, you're pretty much guided and groomed to, perform, have the higher grades, study, do well, even most times over sports. I played a lot of sports, but my parents prioritized school and almost pulled me out of the sports to focus on school. So yeah, it's just part of upbringing, part of the culture, part of just traditions. All of us, actually, I'm the last born of three. My brother's a pharmacist, my sister's a PA, and I'm in med school. So it's kind of just one of those classic, I think, Nigerian immigrant stories for their first generation American children.
And Whitney, how do you see your role as a healthcare provider? I mean, do you approach this, or have you approached this from the idea that you will um, be looking to make a difference in minority communities? Do you feel like you, by your presence, will have a positive impact on the way the medical field will look? I mean, how have you approached some of those identity questions as you work through medical school?
Oh, I mean, 100%. I know that I'm in this not just for me, it's for my patients, for people that look like me, for people that, want to seek healthcare but not feel inferior or feel scared or feel like it's not a safe space. I mean, it's for the people that, I mean, in 2020, we still have African American women dying at like 4 times the rate just giving childbirth. I mean, Serena Williams, one of the most prolific and wealthiest female athletes, nearly died herself. And it just shows that it doesn't matter what your socioeconomic status is, whether you're a celebrity or not. I mean, when you're Black, you're seen as a Black patient. And so it's for a lot of things. I mean, and that maybe is one of the reasons why I do want to be an OB. I think it's just ridiculous. There are so many ridiculous things that I think are disproportionately placed on Black people. And I think part of it is for me to want to reach higher spaces and places. We were talking earlier about representation and how all of these businesses, I mean, it's all for optics. Let's be real. It's optics. Nobody wants to be that company that didn't say the correct words, didn't put out the statement, didn't black out their screen. Like, nobody wants to be that one company. It's not profitable, doesn't look good, it's not palatable. It just looks bad. So let's say the right things. And that's part of it. I mean, I need to get to these higher spaces and places, 2% of the United States, in order to make that change. I mean, all these companies said they stood for Black lives, but then they come out, they have 2% Black people in the whole company, not even talking about executive levels. I mean, there's 0 on the executive levels. So it's I don't know. It's just me trying to do something that's actually going to have action behind it versus the gaslighting that I feel like we're all experiencing right now. None of this is a secret. And when we're talking about what will change it and allyship and things, we have to discuss performative allyship is what I think the new buzzword is. It's kind of triggering because you see a lot of people performing. I mean, there's some people that are protesting just to take photos so that they can maybe, I don't know, 50 years from now, tell their grandbabies that they were part of the movement. I mean, it's a lot, and it's like we always, even discussions like these, I feel like it dances around what really needs to be said. The bottom line is nothing will change if people do not accept the fact that, okay, let me address my own bigotry, let me address my own prejudice, let me address my own racism, and combat that. And that's where it starts. You have to care, you have to want to even do anything about it. So part of it, I think, which is sad, and I my hope is weary because I see all the movement happening now, and I just know that, I don't know, next week if there's a new COVID, uproar, this will probably be in the desk. So I think that we just need to get real. And me being a Black woman, it would be a disservice to my whole community and my life and my legacy if I didn't try to get to the spaces that I feel there is no representation for people that look like me and not do something about it. So I don't know. That's just a couple things I want to talk about: the performative allyship, just the optics, the gaslighting. I mean, those are real things. And the fact that I feel like we're a smart, society. I don't understand why there so many simple concepts are made convoluted all of a sudden. Nobody understands what's going on. Nobody understands why this is racist. Nobody understands. And education is at our fingertips. We all have cell phones. We're walking around with $1,000 devices in our hands. We can quickly Google all of this stuff. Yet we have to have conversations over and over again for what? You know what I mean? When nobody's doing the work, there has to be work that you do as an individual in order to advance everybody. It can't be 1 hour discussion here and then, okay, everybody just goes back, oh, that felt good for me today. It's like, well, what really gets done? Rodney King was 30 years ago. He was almost beaten to death. He didn't die, almost beaten to death. Cops were all acquitted. 30 years later, we see the same thing happening with George, and he actually died. So nothing's really changed. And I'm really I guess, exhausted with talking about the same thing over and over without actually having to change. We put into place the things being addressed, the people addressing their own, advancement of the problem. I mean, racism isn't just, oh, I hate you because you're Black. I mean, it's institutional, it's systemic. It affects us in every part, not just, oh, I feel bad because people hate me because I'm Black. It affects you. What jobs can you get? Food deserts. What access do I have to nutrition? Inner city. I mean, it's just so many things. So it's just like, I don't know. It's kind of hard to really do these things when I feel like it's going to take a lifetime to really just express what needs to be expressed and have the change that we need to have.
Right. Dad, let me ask you the same question. I'd like to hear how you made this decision to come to medical school. I mean, why be a doc? And the same question, the same second part that I asked Whitney, which is, do you feel a unique responsibility, or do you know that you want to enter the medical field largely because of being able to address some of these questions, the disparity questions, and then also some of the broader health questions?
Mine is similar to Whitney's in that, like, my parents are also directly from Nigeria. I'm a first generation American. And they did always present, like, as a young person, as like a child, they would tell me like, oh, they would try to find things I'm interested in. I did like direct myself towards science, and then they always wanted like a stable job that like really that's always necessary. And like my mom is actually like a big example of this for me, in that she was a social worker whenever I was young, when I lived in New Jersey as a child. But eventually she did lose her job, and I mean we ended up moving to Texas, and because she couldn't find like that same type of job there, she ended up having to like transition careers, and she became a nurse. And so healthcare is like a big like part of my parents, because my dad's a pharmacist, my mom's a nurse, I'm in medical school now. Um, and then like I have a cousin who's a doctor. So like it is a big thing, but it is something that I gravitated towards. I almost, by the time I was in college, I didn't know if I really wanted to put in all the work to be a doctor. So I ended up getting a master's in something else and going to work in a lab. And then I figured out that I didn't like it the way I thought I should love my job, which is how I ended up applying and thankfully getting into BCom. To your second point, uh, healthcare, like looking at some of the healthcare disparities among people of color is a big part of why I do want to do it. I realized that I didn't actually meet an African American doctor until I was in high school, and it was like he was the only one in Odessa that I knew of at the time, and my dad works in a hospital, so he knew as many as he could find. And I remember after being introduced to him, and then he let me shadow him for a while, that I was so impressed with him and like how he did with, and it was just like one of those things where I was like, I think I could do this. This seems like a job that would be for me, that I would enjoy. And I do. I love the field, and I can't wait to. I don't know what specialty I want yet, but like I know I would love to like be that example for other people. And then like I know, statistically speaking, that Black and brown people get better healthcare from doctors that look like them. Like they're more likely to trust them. They're more likely to like take their recommendations and follow their advice and whatnot. So it is important that it helps like overall health for me to choose this field.
Dr. Lizzie, I want to tie up with you because I think, again, given that we've got an audience of med students and also faculty, I'm wondering if you can talk to us a little bit about this idea. I mean, I think something that I encounter all the time as a minority professional is the real fear of imposter syndrome, the way that you make your way through these different environments and you feel less than, and it's largely irrational. But if we talk about some of the institutional racism and institutional classism, I mean, it makes sense that imposter syndrome comes out. And I'm wondering if you can, from your perspective now, especially as you move into the executive level, if you could maybe shed some guidance on that for these medical students, and also this question of how you make choices. Because I'll tell you that one thing that's been really frustrating for me over the course of the last several weeks, and I think this is what Whitney's talking about, is that some of these conversations, I often feel like I'm putting myself in check, and I don't want to be loud. I don't want to be sad. I don't want to be vulnerable. I want to provide some level-headed look at what's going on when in fact there's nothing more than this kind of raw emotionality. How do you negotiate that? And especially for medical students that are still trying to, as Dave's pointed out, still trying to find a specialty, still trying to find a home, still trying to find their place in the bigger community. I mean, how do you, from your perspective, juggle these pressures, imposter syndrome, and then also this idea of, have I sold myself out, and have I done it, for a good reason or a bad reason, or have I not done that, and am I still true to whoever I am?
Yeah, so staying true to the game, right? I think there's a host of ways to approach that. I think the first piece of advice I'll give anybody and everybody is you got to be you. Mm-hmm. The emotional turmoil that it takes to not be you is what will kill you first, mm-hmm. right? Now then, saying that, being a professional and being in a professional degree course and planning to be a physician eventually, I would be lying to every single one of you if I don't tell you that the world is going to look at you differently because you're Black. Oh. It is reality, right? And so if we play this sort of head in the sand, naivete game of, well, I'm so angry that I'm going to turbo my chances to be successful, you're not helping anybody. You're not helping yourself, your family. You're not helping the next person that comes behind you, because what they'll remember is when you acted out, right? So, and it's this conflict because you're angry, you're emotional, you're sad. I mean, I got kids, man. I've cried, right? Because I look at my son who's 9, about to be 10, and when he's having nightmares and wants to come into my room because Daddy or the police going to get us, and I'm like, we're in El Paso. So first of all, you're pretty lucky that we're not in Chicago or Minneapolis or Huntsville or wherever it may be. Not that it couldn't happen here, but we've been blessed that El Paso has been a great home for us for the last 10 years. And so I tell people everything is about timing. Right? So when I was a resident, one of the biggest things that I was fighting then was unconscious stereotype training. Right? And the conversation that every time we did a clinical vignette, 35-year-old African-American male would be like, hold up, why does it matter that he's African-American? And they're like, well, that's how we've always done it. I said, because it's wrong doesn't mean, because you've done it wrong doesn't mean it's right. And we literally had arguments for a 12 to 18-month period that went all the way up to the head of the program and beyond, until finally there's no evidence to show that you should say somebody's 23-year-old Hispanic female or 48-year-old African-American male unless they have sickle cell disease or they're an Ashkenazi Jew and there's a genetic predisposition to that disease or the treatment, right? That's just, it's another type of unconscious biasing or tagging, right? And so people don't think about that because, well, this is medical school and this is residency and this is just what we've done. At the same time, right, I could do that because I felt I was in a space that it was relatively safe. You're going to have to pick and choose. And any of you that have ever played sports, right, I mean, basketball or soccer, you can't run 100% all 4 quarters or all 2 halves. You'll tire out. You'll get subbed. You got to pick your time, right? Sometimes it's the first quarter. Sometimes it's the fourth quarter. You got to decide when in medical school, when in residency, when in your professional career you get to push that person or nudge that person or be the light that they see to change, right? And unfortunately, we got to wear the mask. I mean, and that's just the reality. I'm not going to deceive anybody here to say that you can just go buck wild and expect anybody to listen to you. People need to be comfortable in your anger and indignation and drive and lead with education. Anger is very understandable, and sometimes it is what it is, but lead with education. Lead with, how do I pivot this person around? And so, again, this is not something that is easy. There's no checklist manifesto for it. You're going to have to figure it out as you go. But just like I would tell a resident or a fellow or a medical student that does a rotation with me, because it's in your book doesn't mean it's right. You got to figure out as you go. What's that dance? You know, what is that dance to find out where you feel comfortable and where you can do the most, have the most impact? And like I told my son the other day, hey, Daddy, how do I try to not make this happen? And it sounds cynical, and as you know, I mean, Serena had the issue, but the more money you get, the less this affects you, right? And so if you're in medical school, that's not why you went into it, but it is an exit strategy to have the bulk of it affect you. And it sounds cynical and it's ridiculous, and part of it's me being Nigerian, part of it's me being African American, but the more you can extract yourself, but then, and this is just reality because I think about this a lot now that I do a lot of social commentary and fundraising and the rest, the further you get away, then you start to ask yourself, how much did you sell out to get there? Right? And again, so that's the dance that you're going to have to play through your career, understanding that at some point you're going to be a top 5% financially, socioeconomic status, but you still carry the burden wherever I go. People say, well, what should I think, Dr. Lozzi? What should I say, Dr. Lozzi? How do we react, Dr. Lozzi? How do we need to talk? I said, I am not the spokesperson for being Black. Stop, right? At some point in time, you got to figure it out yourself. Man, you got to figure it out yourself. Go educate yourself. Look on, I mean, I hate social media sometimes, but look on Facebook. Stop trying to make me the Martin Luther King of your generation. You killed him anyway. So why, if I got to be MLK? You killed him. So again, these are all the things that being Black and being Hispanic in America are about. We deal with it every day. I encourage everybody, you got to figure it out. You got to triumph, because if you fail, you've not just failed for yourself, you failed for the next 1,000 people that apply to your organization. And if you succeed for a lot more people than yourself. And so it's a weight to carry, but I mean, sometimes it just is what it is, man. It's the game.
I think that that's incredibly important. I think it's a good place for us to tie up the conversation. I'm pleased to be able to host this, and I'm very grateful for Whitney Dayu and Dr. Lozzi to be on today's call. As I said, John Hummer's commitment to extend these conversations and also to work at not only clarifying and enhancing diversity, but also bringing these conversations up, I think is really important. I think that space is always crucial, I think, as Dr. Lozzi points out, in an educational environment, this has to be part of the conversation, especially because there are practical implications as we talk about medicine and we talk about race in the next coming generation. I thank you all for your participation, and especially to Ryan Mayhew, who is in Las Cruces masterminding all of our technology for us. Thank you so much, and have a great afternoon.